Hey guys, it's Luke on YouTube, and today we'll be discussing on osteomyelitis. I'll be kind of slow so that you can get the concepts I'll try and talk about. So we'll first start by the definition of osteomyelitis. Uh, it, it is defined as an acute inflammatory process within the bone marrow, surrounding soft tissue, and that develops secondary to infection of pathogens. So definitely here, what they're trying to tell us is that osteomyelitis comes about due to pathogens, meaning it's an infection. It comes about due to infection with pathogenic organisms and causes the bone marrow, and surrounding soft tissue to inflame. Yeah. So this is what they're trying to tell us. This is the bone and the bone marrow inside, showing the green stuff, and the surrounding tissue over here. So this is showing that the bone is inflamed, even the bone marrow and the surrounding tissue. Yeah. Types of osteomyelitis. So osteomyelitis is categorized into two types. We have acute osteomyelitis and chronic osteomyelitis. Acute osteomyelitis, this requires immediate treatment. Then chronic, it tends to persist regardless of its initial cause and treatment being given. So here, acute osteomyelitis, requiring immediate treatment. So if somebody comes with acute osteomyelitis, and if they are not treated immediately, it develops and becomes chronic osteomyelitis. And when it develops to chronic osteomyelitis, it tends to persist regardless of the initial cause and treatment being given. So it persists to treatment. Due to that, it can cause complications such as amputation. Yeah. So that's what it is. Then acute osteomyelitis is a serious bone inflammation that can result from a previous trauma, puncture wound, surgery, bone, abscess tooth, or infection of soft tissue, the ear sinuses. Osteomyelitis can be the result of spreading infection in the blood, which is hematogenous, and occurs more often in children than adults. So here they're just trying to tell us to say osteomyelitis, the inflammation of the bone marrow, bone, and surrounding tissue can come due to trauma, puncture of wound, surgery, bone fracture, abscess tooth, or infection of soft tissue. Because when there is trauma, meaning there is an opening and the infections can enter, and if they enter, they are transported through the bloodstream to bones. Then if they reach the bones, that's when they start to infect the bone, causing somebody to have osteomyelitis. Yeah. Causative organisms of osteomyelitis. So we have the Staphylococcus aureus. It causes 90% of the conditions. Then group A and B Streptococcus species, Haemophilus influenza, Enterobacter species, and Salmonella species. Mode of infection. Osteomyelitis can only it only has three modes of infections, where we have hematogenous or endogenous, exogenous, and contagious. So on hematogenous or endogenous, this is where the bacteria enters directly to the bloodstream from other areas of the infections. So let's say you have an infection, you have an open wound somewhere on the finger. Then the bacteria enters. Yeah, it enters and is transported by the bloodstream to the long bones there, where it goes to infect the bones. Then exogenous, when the infectious organism enter from outside the body, as in open fracture. Here I can give an example of a person who has fallen, or maybe they have been hit by a car, where the bone is fractured and it's an open fracture. So the bacteria can enter through that open fracture directly into the bone, causing osteomyelitis. Then contagious. This is when the bone infection results from skin infection of adjacent tissues. Yeah, so if skin infections are not treated fast, they can cause osteomyelitis because the bacteria can generate and enter the bones, causing osteomyelitis. The pathophysiology of osteomyelitis. The organism reaches as the organism reaches the bone through the circulatory and lymphatic system in hematogenous osteomyelitis. So here, the circulatory and lymphatic systems. These are the mode of transportation the bacteria can be transported to the bones. The circulatory system by the bloodstream and the lymphatic system in hematogenous osteomyelitis. Then the organism lodges in small vessels of the bone, triggering inflammatory response. So when the organism lodges into the small blood vessels of the bone, it triggers inflammatory process, because inflammatory process, this is definitely a process which is autoimmune, like it is activated to fight infection. So knowing that the organism is a foreign body is in the blood vessels, inflammation is going to be triggered in order to fight the infection. Then inflammation produces increased vascularity and edema of the surrounding tissue, and if this happens, that's why we find swelling. And yeah, we find swelling because there is too much vascularity, and edema is definitely just swelling. Inflammation leads to thrombosis of blood vessels, which begin to release exudate in the bony tissue. Then blockage of the vessels also lead to ischemia and necrosis. Then the exudate seals the bones canacularly and extends into the metaphysis and the marrow cavity, finally the cortex. So here is saying the exudate seals the bones canicularly. So the canaliculi of the bone, there are definitely small holes in the bone. Yeah, small holes in the bone. Then the area of the necrotic bone separates from the surrounding bone tissue, and the sequestrum is formed, which retards the bone. So sequestrum, this is defined as a dead bone. Then canalicular holes of like holes in a bone. Let's take note of the words in blue. And the new bone laid down over the infected bone by osteoblasts is called involucrum. So when a bone is dead, when the sequestrum is formed, the immune system definitely starts forming another new bone, which is an involucrum. Yeah, yes. Then opening in the involucrum allow the infected material to escape into the soft tissue, which causes a soft tissue inflammation too. And superimposed infection in form of bone abscesses may result, making the inflammatory cycle a continuous process. And here we have the signs and symptoms of osteomyelitis. How can you know the person has osteomyelitis? So one, fever occurs due to blood infection. So when there is infection, definitely fever is present. There are pain and tenderness in the affected area. Pain and tenderness comes due to inflammation and swelling. Yes. In infants who cannot express pain, irritability may be present. Then swelling of the affected area, there is anorexia, headache, redness in the affected area due to increased vascularity, warmth in the affected area due to vascularity too. Then difficult in moving near joints and affected area, difficult bearing weight or walking. Then we have the diagnostic tests that we can do to ensure, to be sure that somebody has osteomyelitis. So there are blood tests. We do the complete blood count and erythrocyte sedimentation rate. And we can also do needle aspiration of bony biopsy. So here, before I go here, complete blood count is just a test that is done to see how many blood cells are present in there, because when we have more blood cells, it definitely means there's an infection. So needle aspiration of bony biopsy, x-ray of the affected part, and computer thermogrammy scan. This one shows the detailed images of any part of the bone, such as bones, muscles, fat, and organs. There is magnetic resonance imaging, MRI. This is a diagnostic test which produces detailed images of organs and structures within the bone. Then we can also do ultrasound to view. This one is to view. It's just to view the internal organs as they function and to assess blood flow through various blood vessels. Treatment. How can we treat osteomyelitis? So the goal of treatment of osteomyelitis is to get rid of infection and reduce damage to the bone and surrounding tissue. So that's what we aim at, like when we're treating osteomyelitis, just to reduce the damage to the bone and the surrounding tissues. So one, we can give antibiotics. Often a combination of antibiotic is given uh, is given through IV for at least for at least 4 to 6 weeks. After IV drugs course has ended, the patient should continue oral antibiotics for weeks or months. Yeah, there is also the surgical management. If antibiotics don't do their work, they fail, that's when we go to surgical management. Here we have sequestrectomy, the removal of the dead bone to allow liver circulation of tissue to promote bone healing. So this sequestrectomy, we say sequestrum is a dead bone which has degenerated and it has undergone necrosis. So in order to make the goal of treatment is to get rid of infection to reduce damage to the bone and the surrounding tissues. So sequestrectomy is done to reduce damage and infections to the surrounding tissues, because the bone is infected, that's why it died. So then we go to amputation. The affected limb may be amputated in the above surgical procedures to prove to be unsuccessful. So if sequestrectomy fails, that's when they undergo amputation in order to reduce the risk of infection of other tissues. Yeah. And there is debridement. This involves the removal of sequestrum and the surrounding granulation tissue. All infected and compromised tissues are surgically excised, including skin, muscle, tendon, ligaments, and bone. Then foreign bodies and surgical implants are removed also. Yeah. So guys, for today, that's what I had. Thank you for your attention. Subscribe for more things like this, and I'll be giving one condition each and every day. Yes, so I would like you to subscribe so I don't miss anything that I send, and you will be like, you're not going to be outdated, you're going to be on date for everything that I post. If you find this helpful, you can just comment down below and tell me what you want me to talk about, then I can do that. Yeah, thank you.